Right, I'm going to be performing my abdominal assessment. This is where my computer is sitting. This is where I am doing a brain dump and all my equipment, and this is my patient. So, Alyssa's going to time me here for a minute while I do my brain dump. And I'm going to start now. All right. Hi, my name's Hannah. I'm going to be your student nurse today. I'm going to provide hand hygiene. The door is closed for privacy. Can you state your name and date of birth for me, please?
Alyssa Husker, 10/28/2004.
All right, I'm just going to verify that on your wristband here. Perfect. Your provider asked me to come in today to perform an abdominal assessment. Would that be okay for today?
Yes.
Awesome. For this assessment, I will not need PPE. Before we begin, is there any allergies that I should be aware of?
Penicillin.
Okay. So, yes, okay. So we're going to begin with gathering and cleansing my equipment here. While I'm doing that, when's the last time you urinated?
15 minutes ago.
Okay. Just gonna throw this away here. And then I'm going to place the patient in a comfortable position. Patient is going to be supine with the head slightly elevated, and I'm going to place this pillow underneath the knees so the knees are slightly elevated, just to prevent the abdomen from being strained during the assessment. And I'm also going to ask you a couple questions here. When's the last time you had a bowel movement?
Last night.
When's the last time you ate something?
This morning.
And do you have any current abdominal pain?
No.
Okay. So just going to start with some inspection here. So just, I'm going to have you lift your shirt up and I'm going to pull these down a little bit. So just looking at the color, patient's abdomen does appear to be a little more pale than exposed extremities like her arms here, but it is still an appropriate color. Size, the abdomen is proportional to the patient's body. I'm not seeing any distension. Contour, the patient's abdomen is flat. I'm not seeing any masses or bulges. Have you had any history of hernias?
No.
Okay. Not noticing any scars, any lesions, any striae, none of that. Hair distribution, the patient does not have any hair on her abdomen, maybe some peach fuzz, but nothing concerning or a lot of. And movement, I'm not seeing any peristaltic waves, so inspection is good. So I'm going to begin auscultating. So I'm going to take my stethoscope here with the diaphragm side, and I'm going to auscultate the 4 quadrants, starting in the right lower quadrant. All right, vowel sounds sound good. They're active. And then I'm also going to auscultate the vascular sounds. So we will be doing aortic, renal, and iliac. We are going, and this I'm going to be using the bell side. Have you suck in for me? All right, vascular sounds sound good. No bruise that I could hear. And then I am going to be lightly palpating the patient's abdomen. So with this, I'm checking the surface characteristics. So just looking for any muscular resistance, any bladder distension, or any tenderness, making sure to observe the patient's face while palpating. So just, are you having any pain or or tenderness while palpating? No. Alright, and I wasn't feeling any of the abnormal surface characteristics. And then I believe that is all for the assessment. So I am going to end with thank you for being my patient today. Is there anything that I can do for you ahead of time?
No.
Alright, so I would make sure that the bed is locked and lowered. The side rails are locked and secured up if wanted. The table is within reach, the call light is within reach, and the pathway is clear of any obstructions. I'm going to perform hand hygiene. The 5 moments of hand hygiene are before touching a patient, before a procedure, after touching a patient, after touching a patient's surroundings, and after touching bodily fluids. So, I am now going to cleanse my equipment. During the assessment, the patient, I did not observe or hear any abnormal findings or deviations. I will document in OneNote for the assessment. I will clean up my supplies. And that is all.